In this video, a 74-year-old female presents to the physician's office for evaluation of choking spells, dysfunction. So this patient has choking spells, dysphagia, and coughing. She suffers from recurrent pneumonia and has a long history of hypertension, pneumonia, hypertension, but no other medical problems. Barium swelling is shown below. Now the question says, which of the following is most likely cause of her symptoms? So we can see that this actually a Zenker diverticulum, and the reason we know it's a Zenker diverticulum is because she has coughing spells, she has dysphagia, she has choking spells, and she has recurrent pneumonia. That's because she has this diverticulum right in her esophagus, and she's 74, she's old, oftentimes she aspirates those food onto her respiratory system, and she has pneumonia and hypertension. She's 74 years old. Chances are she might have a chronic illness like hypertension. So that is not surprising. But from the history of her situation, we know that this is Zenker diverticulum. Now the question is saying, which of the following is the most likely cause of her symptoms? So now let's talk about the most likely cause why she has a diverticulum at the back of her neck. What happens is sometimes cricopharyngeal muscle fails to relax. Okay, by the way, let's talk about swallowing first. Swallowing has three phases. There is the oral phase, which is the voluntary movement of putting the bolus at the back of the mouth. Then the pharyngeal phase, which will put the food onto the esophagus, and then the beginning of the esophageal phase, which will cause the food to go down the esophagus through peristalsis. So sometimes what happens, the cricopharyngeal muscle is going to have dysfunction. There is going to be cricopharyngeal muscle dysfunction. As a result, there is going to be even diminished relaxing of the pharyngeal muscle during swallowing. Because of diminished relaxation of the pharyngeal muscle during swallowing, food will herniate through a zone of weakness. And that zone of weakness, that pocket of weakness is it causes this Zenker diverticulum. It is just because the cricopharyngeal muscle is not relaxing so easily, so you have to push your food bolus harder at the back of the mouth to swallow, and that herniates through a zone of weakness rather than pushing. At the beginning it's going to push down the cricopharyngeal muscle, but as a zone of weakness is created, it's going to cause a diverticulum. And this is very, very common in elderly. Now this kind of diverticulum is a false diverticulum. There is true diverticulum, and then there is false diverticulum. And what's the difference between true diverticulum and false diverticulum? True diverticulum is when all the layers of the mucosa is there's a mucosa, the submucosa, all the layers are going to be involved. A true diverticulum might also include the muscularis mucosa, the adventitia. So all the layers are going to be involved in a true diverticulum. But Zenker diverticulum is not a true diverticulum, it's a false diverticulum. As a result, Zenker diverticulum is only going to have mucosa. A false diverticulum is only going to have mucosa involved. Anyway, so that's about Zenker diverticulum. Let's go and do the question. The question says, which of the following is the most likely cause of her symptoms? Okay, A. So we talked about the most likely cause of her symptoms is the, two reasons. First of all, the cricopharyngeal muscle dysfunction. That's one. Another reason is there is going to be a point of weakness through which a diverticulum can form. So we're looking for something similar to those 2 points of our interest. So the option says A, degenerative changes of the myenteric plexus. No, that is not involved in any of these. B, cricopharyngeal motor dysfunction. Bingo, that's our answer, right? That's exactly what we talked about here. C, scarring and traction of the esophagus. No, this is even before it enters esophagus, right? It's right before it enters esophagus, so that is also not true. D, retention cyst due to duct obstruction. Retention cyst, no. this is a cyst is not there. It's in fact a diverticulum is created. Duct obstruction, there is no duct that we're talking about here. E, increased intraluminal pressure in the stomach. It's not even close to stomach. So again, that is not the right answer either. So what are they really talking about here? With the different options. Even though we talked about that this is Zenker diverticulum, let's talk about what are they talking about with the other options. So first of all, we have A, which is showing that this is the degenerative changes of the myenteric plexus. Degenerative changes of the myenteric plexus, that is achalasia. Okay, that's how they would describe achalasia. Choice B, cricopharyngeal motor dysfunction. We already talked about that. This should actually be choice C. Choice C, scarring and traction of the esophagus. Scarring and traction of the esophagus is going to create true diverticulum. That's usually seen at the midpoint of the esophagus, and it's usually due to mediastinal lymphadenitis caused by TB, fungal infections, etc. So that's C. Choice D, retention cyst due to duct obstruction. That is retention cyst. Whenever there's a cyst and for some reason the duct is obstructed, you have retention cyst. So that's choice D. Choice E, increase intraluminal pressure in the stomach. Increase intraluminal pressure in the stomach is caused due to Mallory-Weiss syndrome. Okay. Increase intraluminal pressure happens due to retching and stretching during vomiting.